think the thing that I love about Listening into Action and Pass It On events is that ability to share and communicate the great improvements that people are doing. And people are doing this on top of their day jobs. And for me, that is incredible. But the passion that they've got to move things forward is fantastic.
And it's an opportunity for all of those frontline innovators to share the impact of the changes that they've been leading with other people.
It gives staff the opportunity to come up with ideas that they can make improvements and make care more patient-centred.
Fantastic way of giving staff the voice to make the change. We're the ones dealing with these situations every day, and it's often where the good ideas come from.
Last week I was speaking at the Patient Safety Summit in Manchester. Near the end of the presentation, one of the most prominent nurses in the country stood up and she said, "Can I just say, Sue, that your team at Morecambe Bay is absolutely inspirational after all they've had thrown at them, after all they've been through, to continue to improve in the way that you have done and be an inspiration to the rest of us is absolutely phenomenal."
And we felt that between the three area teams, so Kendal, Lancaster and Furness, we don't know always how we are working, whether though the principles of patient care are the same, the way the sites operate, the way we talk, the way we meet in the corridor and hand over a referral sticky level, the way we fax is very different. Now we have got one-stop clinic on all three sites. We've got one in Furness for Lancaster on Friday, we've got one in Kendal on Tuesday, and we've got one on Monday at our line.
We did feel that there was some opportunity to improve the care pathway and the care that we are able to give to patients with mental health. We have a crisis team within A&E 12 hours a day, 7 days a week. We have time and patient assessments, initial assessments. We've had 15-step service users, and we got really positive feedback about that, far more positive than we anticipated.
For our mission was to improve the quality of care of acute kidney injury patients in line with the NICE Clinical Guidelines 169. We've been able to have a reduction in our patient mortality from 25% to 18.6%, which is a 25% reduction in AKI mortality. We've achieved quite a lot, and it was a matter of a celebration of our achievement. It's not a project, so it's going to continue for a long, long time.
We wanted to reduce harm through the reliable delivery of the Sepsis 6. And essentially the Sepsis 6 means that what we give to our patients is oxygen, antibiotics, fluid, blood cultures, we check their lactate and we measure their urine output. So by the end of the year, we've now managed to achieve a 56% compliance with sepsis screening. So that represents that out there on the wards, your teams are picking up screening documents and they're asking themselves much more frequently than they were before, could my patient have sepsis, and ticking the boxes where appropriate. Our biggest hope is that we can encourage staff to recognise sepsis and to initiate the Sepsis 6 actions within 1 hour of recognising that a patient has sepsis and follow a sepsis pathway.
So the difference that we made, in the past, EDD and CCD were rarely or never recorded in the medical notes, and the data from the early audit showed only around 30% of patients had EDD and CCD recorded. But by March that had massively improved to 87%, and our current data shows, we did an audit last week, that 94% of patients had an estimated date of discharge recorded and 100% of the clinical criteria for discharge recorded.
You don't realise what you're doing until you're actually explaining to somebody else where you've started from and where you've ended up. You don't realise actually how much you've achieved.
It's important we share the good news to everybody. We know how we're doing, and that motivates other people to work hard and get good results, and that is good for the patients and it's good for our staff morale as well.
It was quite empowering actually. I mean, I'm kind of fairly new to the job, and it's quite nice to be considered a part and to be able to give my input in a way that I know is going to impact others in a positive way.
We've raised awareness of the causes and effect of hemolysis through presentations to the senior ED team. We raised awareness of hemolysis through presentations and discussion at small, big conversations. And we've encouraged an environment in which staff can make suggestions and think of new ways, improving the patient journey, the care and experience, improving quality, reducing waste and improving staff experience too. It's been amazing actually. It's been really good to work with teams from other departments within the hospital and to see their engagement.
So a lot of the criticism or a lot of the feedback around Lorenzo fell into this group, that the system was untrustworthy, too slow, and it was unreliable. But there are 3 or 4 things that happen this year which are going to make a really big difference. And when we look at them all together and stack them up, I think it's going to be a big improvement.
Wanted to look at reductions in the incidence of harmful incidences, but also in grade 2, making sure that people have the knowledge around the grading of the pressure ulcers to start off with.
We have done a full round of every department and every ward. We have hit 96% of wards and departments with our 15-minute pressure ulcer update training.
Congratulations to all of you, because we know that you're the ones who've done all this, because it's fantastic. And you can go out there and be very proud and spread the word.
You're saving lives, you're actually saving lives. People will be seeing their grandchildren and weddings that they might not have seen had you not done the right thing.
All the improvements can demonstrate they've made a difference. Some are small and some are really big, but they've all made a difference to patients and staff working in Morecambe Bay.
This has been an amazing set of Pass It On events for us. We've been trying out new things and improving and testing out how we can better get our messages across from our staff about how they've made improvements to services for their patients and for their staff. So we've tried the Pass It On events at each of the 3 sites. And they've been really well attended and supported by teams. So it's worked really, really well. Hard work setting up, but so worth it. It's great that our staff are leading the innovations. It's great that people are starting to talk about Morecambe Bay for very positive reasons. And I think our staff should be very, very proud of what they're doing and keep doing it.